Hello, this is Dr. Jerry Cuomo. I'm here with Michelle's case, and I'm looking right now at from the anterior region through the dental microscope, and I'm checking now the lingual surface, of which the chief complaint was the feeling of bulkiness on the lingual aspect. Not really feeling comfortable with the lingual aspect, nor the facial surfaces. And so if we examine the case more closely, we can see that she does hit on tooth number 6 from the lingual aspect. But then again, as you turn the corner and go from 6 to 7 and to 8, you'll see that there's a more convex surface and no feeling of normal anatomy on the lingual aspect. Again, we're moving now toward number 8 and number 9. You can see how the convexity gets even more and more intense, all the way to number 10, and of course number 11 is just almost like a round shape, like a light bulb shape to it. So what effect are we getting on the lower dentition because of the lingual convexities? We'll take a look right now. We see that yes, she's had some bonding placed on tooth number 24. She also exhibits some wear on 22, as well as tooth number 27. Go ahead and close and swallow. Okay, and other things noticeable is that the teeth seem to have more of a closed-in appearance, more angulation than maybe that's necessary, and they're not as individualized, and also the color is a more opacified color because it is made of a metal ceramic bridge. So our mission today is to go ahead and remove the 6-tooth bridge, go ahead and make her temporary, and then also try to compare the lengths of one side to the other. Try to divide it up into 2 3-tooth bridges so we can get an idea of where we are today and where we're heading, for the future. Phonetics is important. We want to be able to have her be able to enunciate her S's and her V's. So we're shooting for a little better phonetics here. Also, she knows that we may have to work on those temps a little bit longer in case that we need any further modifications due to phonetic issues. Then we're gonna, with time remaining today, if we can prepare the bicuspid region and lower, it's gonna be on the bicuspid here on number 4, number 13, and also the molar on the mesial buccal aspect of the molar. We'd like to fill that in with a veneer as well. She's got some gingival recession, which we may fill in first before doing the veneer prep on number 14. That's the only thing I probably did not mention, that there's a little neck issue here on 14 that may need to be filled in. All right, other than that, and we're also looking at modified ridge lap ponics, and because they do not invite themselves well for any type of cleanliness, self-cleanliness, she's been always annoyed by this gap space underneath these ponics, and we're going to take care of that today by transferring the design from a modified or full ridge lap, as you see here, to an ovate ponic, which is more of an eggshell as I described it to her. I thought that the labial aspect where they ended these ponics is a good goal for us to end our ovateness there as well. So we'll use this. We can get these bridges off and without wrecking them completely, then we can probably pick up that line again and go ahead with her ovate. Otherwise, we can just estimate between these two teeth. So between the cuspid and the centrals as to where to place that free gingival margin for the opaque for the ovate ponic. All right. That's it from here. I'm going to get started, and we'll pick this up again in the next segment to discuss our findings.